Welcome to Back to Health, your source for the latest in health, wellness, and medical care. Keeping you informed so you can make informed healthcare choices for yourself and your whole family. Back to Health features conversations about trending health topics and medical breakthroughs from our team of world-renowned physicians at Weill Cornell Medicine. I'm Melanie Cole, and today we're discussing advances in sleep apnea care. My guest is Dr. Maria Cerna. She's an assistant professor with Weill Cornell Medicine. She's an ear, nose, and throat, head and neck surgeon and board certified in sleep medicine. Dr. Cerna, what's the health burden and economic impact of sleep apnea and sleep disorders in general?
Sleep apnea has been getting much more attention because we're now much more aware that untreated sleep apnea that leads to health problems, especially cardiac disorders, depression, hypertension, diabetes. It's also associated with a lot of motor vehicle accidents. People are 3 times more likely to get in a car accident if they have untreated sleep apnea. It also has very significant economic impact as well, and not just from the healthcare standpoint, but also absenteeism from work, poor attention span, people actually getting into industrial or car accidents. And so it's actually been estimated that economic burden could be somewhere around $150 billion a year in the United States. So, unfortunately, majority of patients with sleep apnea actually go undiagnosed. And so if we could diagnose more patients with sleep apnea, then those costs could be potentially cut down, and then also people can have actually their health issues prevented that could be easily prevented by just diagnosing and treating sleep apnea.
Who notices sleep disorders? Is it a loved one, your partner, or are there symptoms that you would notice in yourself?
Well, patients are not really they're not usually aware of their problems with sleep. A lot of times their family member or a bed partner would complain of them snoring or having disrupted sleep, pausing during sleep, having very restless sleep. So they will be the first ones to complain about sleeping issues because their quality of sleep is also disturbed just because their bed partner is sleeping very loud or has a lot of movement during sleep or wakes up throughout the night. So, but as far as patients themselves, they usually might complain of fatigue or waking up with headaches or not feeling fully rested, even despite of sleeping for 7 to 9 hours. And sometimes they fall asleep during the day. They might be falling asleep driving. So sleepiness is probably one of the most common complaints from the people with sleep apnea. But again, a lot of times they just might blame it on some other factors and not necessarily be aware of ongoing problem during sleep. So a lot of times, actually, yes, you're right. The loved ones and the family members are the first ones to point out that there is some sleep disturbances in the individuals.
Who is most at risk for sleep apnea? Is there a genetic component? And what are some medical disorders that may induce sleep disturbance or sleep apnea?
So, there's definitely some genetic component to sleep apnea because people who have their parents or grandparents or siblings who have sleep apnea, they also seem to be more likely to have sleep apnea. In general, older people, men more than women, and certain ethnic populations, they actually have more predisposition to sleep apnea. There's definitely, as I said, there is a genetic component. We just don't have we haven't really fully discovered the underlying genetic gene or genetic group specifically that we can actually test for, but and definitely there is a positive there's a presence of positive family history of sleep apnea. Also, people who tend to have more of a bigger, larger neck size, who have crowded airway, and the sleep apnea is more prevalent in people who are significantly overweight. And obesity has been kind of slowly progressing problem in this country, and there's very, very high association with sleep apnea when people get over a certain weight.
So I think a very important question are some of the complications of untreated sleep apnea. Some people don't even know that they have it. And so what else can it cause if it is not diagnosed and treated?
Well, again, a lot of people who have sleep apnea, some of them might not even be aware of it because they might be living alone. Their bed partners might be sleeping in a separate room, or their bed partners are so used to it and they just maybe be sound sleepers and they're not really paying attention to what's happening with their loved one. But if a lot of times it's actually people don't really experience any health issues. Some people actually don't even feel tired despite of having sleep disturbances during the night. But some of the things that are commonly associated with untreated sleep apnea is actually persistent high blood pressure. People are at a high risk of developing heart disease and irregular heart rhythm. They're more likely also to die from untreated sleep apnea. And also getting into car accidents. So I think, car accidents, they're not necessarily just putting that individual at risk, but they're also putting other people at risk. So I think those are some of the main issues with untreated sleep apnea. And as a society, it's kind of hard to ignore it just because of the not just individual, but also effect on the society as a whole, and especially when we're talking about public transportation, especially when we talk about derailing of the trains or accidents that are caused by when it's actually more of a public transport, and the person who is operating the vehicle has actually untreated sleep apnea. So from that perspective, it's not just individual, but also a social concern.
That's an important point, Dr. Cerna. So tell us a little bit about diagnosis. How is the assessment and evaluation done to find out that someone has sleep apnea?
So a lot of times, as I said, a lot of people come in because they're mostly either referred by their primary care physicians or who are suspecting that patients might have sleep apnea just based on their history and their exam or even past medical history, or if their spouses actually encourage patients to get evaluated. So obviously the diagnosis starts with thorough history, physical exam. Still gold standard diagnosis for sleep apnea is actually performing a sleep study. And the sleep study nowadays can be performed either in the lab, where patients go in and spend the night in a kind of outpatient healthcare facility, or they can actually take equipment home and do the sleep study in their home environment using portable equipment.
So you said that they can bring equipment home because people hear about sleep studies, Dr. Cerna, and they're anxious and they wonder how they can even get to sleep with somebody watching them or if they're all hooked up. How can you get a good result at the actual clinic for a sleep study, and what's the difference between what they have to do at home?
Right. So yeah, that's a very, very good point. Patients do get a little concerned about sleeping in the unfamiliar environment. So in the lab sleep studies, yes, you do have to spend the night somewhere outside of your bedroom, outside of your comfort, outside of comfort of your home. It is in a facility that sometimes could be not exactly the right temperature. Sometimes it could be it might be a little bit noisy. And then again, being in a familiar environment, some people feel very uncomfortable. So that's one of the downside of doing this study in the lab facility. So some of the things you can do. I mean, it's kind of hard to say what you can do. Try to get into the lab at the time where you're about to to go to sleep. So you're trying to schedule the sleep study during the time when you normally would go to sleep. We usually suggest for patients not to drink too much caffeine, avoid alcohol, and try to avoid naps before going for a sleep study, and try not to do any kind of activities that are more stimulating and trying to stay more relaxed and avoid any kind of anxiety or any kind of stressful situation. So by the time they get to the sleep lab, they can be relaxed and ready to sleep. And so Yes, unfortunately, the most uncomfortable part I think is mostly like the wires that get attached to the head and chest, and little sensors that are being placed on the body. Nowadays, they're trying to kind of make them more comfortable and minimize and make them smaller, but that is still some people find it very, very uncomfortable. So that's why the home sleep studies actually have gained more popularity because this is something that you can bring home with you, and you can use that in the comfort of your home. They're much easier to set up because a lot of those home sleep studies just really have like a finger sensor and like a sensor that you put on your chest, and some of them have a little bit more sensors that are going to go around your face and your not just your fingers in the chest, but something also that comes onto your face as well. But depending on the equipment type, but a lot of those take-home studies are much more comfortable and easier to use, and then also patients are not their sleep is not disrupted by being in an unfamiliar environment. There is a little bit of a difference when you talk about doing in the lab versus home sleep study, because in the lab you can get, it's a monitor sleep study. Somebody's always like watching you sleep. If there's something that goes wrong, there's a sensor is off, you can actually have the technician help you replace it, and they're also are able to get more information, and not just about sleep apnea or obstruction, but also about sleep stages, about breathing patterns, about your heart rate, about movement, and et cetera. Some of that information is not really available when you perform a home sleep study. So home sleep studies, they're good for patients in whom you suspect sleep apnea, obstructive sleep apnea. But when it comes to diagnosing some other sleep disorders, we still rely mostly on using sleep lab facilities.
If someone is diagnosed with sleep apnea, tell us about the first-line treatment and explain what CPAP is. They've heard about it in the media, and tell us what it is, how it works, and is there an issue with adherence to CPAP and compliance, and are people not wanting to use this device to help them?
Right. So CPAP has been available to people since about like 1980s, like early 1980s, and that was at that time it was a revolutionary treatment because it allowed people to be treated without actually undergoing any kind of invasive procedures. So what CPAP is, it's equipment that gets placed over patient's face, the nose or mouth, and it provides positive pressure that allows airway to stay open. Because if you think about what sleep apnea is the airway obstruction during sleep. What happens is the muscles relax, and once the muscles relax, the airway starts to collapse. And if the airway collapses, it reduces the airflow, and occasionally people can actually stop breathing for a period of time during sleep. So what CPAP does, it provides positive pressure that stents the airway open and prevents it from collapsing. And it's an effective treatment, and you have to wear it on your face every single night and the entire night in order for it to actually prevent sleep apnea and provide people with treatment benefit. So a lot of times people find, some people find it amazing. Some people actually put the mask on and they sleep so much better with the CPAP that they cannot imagine sleeping without CPAP anymore, ever. Some people find that the mask is uncomfortable. They don't like having anything on their face. They try. So over time, they can get desensitized from it, and they can get used to it. It's in some cases, it's more of a matter of finding the right mask, the right fit, the mask that actually is comfortable, that doesn't restrict their mobility and doesn't restrict their movement, and doesn't disrupt their sleep. Some people find it being very claustrophobic, so no matter what type of mask they put on the face, they just feel that that's suffocating and they just can't use it. So it's very individual. So you kind of have to approach each patient with a little bit more individual needs, depending on one, the severity of sleep apnea, two, their anatomy. Can they use the nasal mask versus like a full face mask? Because in some people, if they're, for example, mouth breathers or they have blocked nose, I mean, those are some of the, in those cases, the nasal mask might not be the right fit. So doing more of an individualized approach and actually looking at patients' anatomy, their needs, their severity of sleep apnea might be the key of trying to get them fitted with the right mask. And then also patients could try different masks. They can try different sizes masks, different material, like masks could be made out of different materials, and et cetera. So compliance is an issue, and the CPAP is only as effective as compliance with the treatment. In order to benefit from CPAP, you unfortunately have to wear it all the time, the entire night, and pretty much for the rest of your life. Currently, the compliance rates, like long-term compliance rates, are about 30% or so in general population. With more of a therapy, like CPAP desensitization and trial of different masks, like the compliance could be improved. There's also machines that have gotten quieter, and then also there is auto-adjustable pressure on some of the machines that kind of again adjust the strength of the pressure, like air pressure, depending on the people's needs. So some of those things have been have evolved, like technology has evolved, so that has improved patient compliance. But again, it's still not, it still has been the major issue when it comes to treatment is the compliance with the treatment.
So tell us about a new alternative to CPAP. Speak a little bit about hypoglossal upper airway nerve stimulation and what that is as compared to CPAP and how it can help patients.
So CPAP is still, as I mentioned, is considered to be the gold standard treatment, the first treatment, and it's non-invasive treatment for people with sleep apnea. If people are not able to tolerate CPAP, then we start looking at the alternative treatment options. Some of the alternative treatment options include oral appliances, mouth guards that could be made by the dentist. And what they do, they pull the jaw slightly forward, and that opens up the airway and prevents airway from collapsing and prevents the tongue from collapsing during sleep. And so that can be very effective for some patients. If that's not if this is not a treatment option for whatever reason, and people cannot either tolerate the oral appliance or they are not candidates for oral appliance, then we start looking at the surgical treatments. And in the past, the only surgical treatments that we could offer were the treatments that were geared towards opening up the airway by either removing some of the palate and tonsillar tissues, or reducing the size of the tongue, or moving or changing craniofacial structures by moving the jaw forward. Nowadays, we have an alternative therapy available, which is an implantable device. This device is implanted. It's kind of similar to like a pacemaker type devices, and it's implanted under the skin, and the device is connected to the nerve, a hypoglossal nerve. This nerve innervates the tongue and moves the tongue forward, and also is responsible for opening up the airway by protruding the tongue forward and stiffening the muscles of the airway. So during sleep, the device, so before you go to sleep, you turn the device on, and then once you're asleep, the device provides mild neurostimulation to the nerve, and that in turn opens up the airway with each breath. There's also a breathing sensor that sits between the ribs and monitors the airway, the pattern of breathing in each individual. And the device then tries to deliver neurostimulation before each individual breath so that it keeps the airway open and prevents it from collapsing. It is a surgical procedure. It's an outpatient procedure that requires an implantation of the device. People usually go home the same day, and its recovery is a couple of days of recovery from just the incisional discomfort, but that does not result in any long-term sequelae in terms of swallowing issues or changes in the anatomy of the airway or changes in structural changes of the face or in the throat.
Wow, what a fascinating discussion about sleep apnea that so many people suffer from, and some don't even really realize that they do have sleep apnea. It's so important that they get it diagnosed and get it treated. Wrap it up for us, Dr. Cerna, with your best advice regarding sleep apnea and getting diagnosed if you think that you might have some of the symptoms or risk factors that you've mentioned here today.
I think it's very important to get diagnosed and to know whether you have a sleep apnea. If you feel that you don't get quality sleep, despite of many hours of sleeping and staying in bed, if you feel like you're waking up tired during the day, you feel fatigued, fall asleep while in the meetings or during the day, during lunch meetings or even watching TV or easily fall asleep behind the wheel, then those could be some of the symptoms of potential sleep apnea. Also, pay attention to what your bed partners and family members say, because sometimes they could be the first to notice breathing issues during sleep, especially when it comes to airway obstruction and snoring. If that's the case, then I would suggest to start at least with your primary care physician so that they can direct you towards the right treatment, recommend either sleep specialists who can further evaluate you or diagnose you with sleep apnea.
Thank you so much, Dr. Cerna, for coming on with us today and sharing all this great information about sleep apnea and the importance of getting diagnosed. This concludes today's episode of Back to Health. We'd like to thank our listeners and invite our audience to download, subscribe, rate, and review Back to Health on Apple Podcast, Spotify, and Google Play Music. For more health tips, please visit weillcornell.org and search podcasts. And parents, don't forget to check out Kids Healthcast.
Rehabilitation medicine can help patients with a wide array of disorders and diseases, including cancer. If cancer care is of interest, listen to CancerCast, Weill Cornell Medicine's dedicated oncology podcast, featuring leaders in the field and patient stories. CancerCast highlights dynamic discussions about the exciting developments in oncology.
All information contained in this podcast is intended for informational and educational purposes. The information is not intended nor suited to be a replacement or substitute for professional medical treatment or for professional medical advice relative to a specific medical question or condition. We urge you to always seek the advice of your physician or medical professional with respect to your medical condition or questions. Weill Cornell Medicine makes no warranty, guarantee, or representation as to the accuracy or sufficiency of the information featured in this podcast, and any reliance on such information is done at your own risk. Participants may have consulting, equity, board membership, or other relationships with pharmaceutical, biotech, or device companies unrelated to their role in this podcast. No payments have been made by any company to endorse any treatments, devices, or procedures, and Weill Cornell Medicine does not endorse, approve, or recommend any product, service, or entity mentioned in this podcast. Opinions expressed in this podcast are those of the speaker and do not represent the perspectives of Weill Cornell Medicine as an institution.